So, you know the misery when you have a high fever, you have body aches, where your bones ache, your bones hurt, your muscles hurt, terrible headache, coughing so hard that you can crack a rib. You know how miserable you are when you're sick with, say, the flu, or if you've had COVID that is a bad case? Well, imagine how it would be if you didn't have anything to take, like no Advil, no Tylenol, no heating pads, no heating blankets, nothing. You just had to lay in misery with it. Well, that's how it was in the medieval times. They didn't have anything for comfort. So when the Black Plague came around and millions died, they died a horrific, miserable, painful death. We're going to talk about the Black Plague today, or it has also been called the bubonic plague. So let me give you an idea about some numbers here. The bacteria was finally discovered in 1894, but that was after it already had a couple other pandemics. So it is caused by a bacteria called Yersinia pestis, or Y. pestis. And here's how it's transmitted. It's transmitted by fleas or animals. It's also transmitted in the air. So if a flea needs another host and the animal has died, or you're living among rats in rat-infested areas, sick animals, sick dogs or cats as time went on, sick animals, pigs, they need a host, and so they go to a human. So what happens there is the human gets bit, and then the human becomes very sick. There are three types of the Black Plague. The first type is called the bubonic plague, and that's what most people think of when they think of the Black Plague or Black Death. And that is because with that type, people have these huge, swollen, extremely painful lymph nodes here, in the groin, and under the armpits. And this bacteria gets in there, it becomes infected, very big and swollen, and then can open up, and it is black pus that comes out. The other type of the plague is the pneumonic plague, and pneumonic, you think of like pneumonia, lungs. So that is when it is inhaled and it is in the lungs. The other type is septicemic plague, and that is when both of those go into the bloodstream. Or you can also have it directly into the bloodstream from the start. How is it transmitted also? So how you get it, besides this, we think of the flea and the animals and going on to humans and getting bit by the animal or getting bit by the flea. But if you have people around you and you live in close quarters, like a lot of them did in the medieval times, and they did live in poverty in a lot of the areas, they didn't have good nutrition, so their immunity was down. This bacteria took off and it spreads very quickly. When other people around you have the plague and they are coughing, sneezing, coughing up blood, and you're breathing all that in, they're vomiting, and you live in a quote close area, you're breathing that in. That's just how you're going to get it, or how you would get it at that time. There were three pandemics of Black Plague: the 6th century, 14th century, and 19th centuries. It killed millions of people, and the survival rate, it depends on what you're reading, but there's survival rate about 50%. So why did some survive? Some even got it and survived. So we'll talk about that in just a moment. The first plague, called the Justinian plague, was 6th through 8th centuries. Estimated deaths to be around 25 to 50 million people. The Black Death, 14th through 17th centuries, they called it the Black Death at that time, and the estimated death rate at that point for that pandemic was 75 to 200 million people. The third plague pandemic was the 19th and 20th centuries, and that is estimated to kill approximately 12 million people. The third pandemic at that time caused millions of deaths, yes, but is particularly in the area of India and China. But this pandemic helped lead to the discovery of the bacteria called Yersinia pestis. The estimated total deaths over all of these pandemics is 100 million people. It affected elderly, pregnant women, children of all ages, men and women alike. Where in the world did it start? Literally in the world. It started from China and India and came along the trade routes into Europe and England in the 14th century. Looking at ancient bones to see what caused the Black Death has been something that a lot of paleontologists, researchers have been working on, because they want to know, why was it so virulent? Why did it kill so many people so rapidly? So that we can learn from it. But when I tell you how they, at that time, without any knowledge about pandemics, about transmission of illnesses, about hand washing, anything, if I tell you, when I tell you how they tried to handle it and contain it, you're going to think that we're talking about the recent COVID pandemic, because they did things pretty much identical and tried their best at that time to contain it, to stop it from killing people, to stop it from spreading. So in 1347, it arrived in Italy. It is also, from the researchers today, they also feel like the bad sanitation, like I talked about, the poor food quality, the low immunity, a lot of people weren't well, they didn't live very long. That's a big reason why a lot of them died. But the other reason is a lot of researchers today feel that tuberculosis and tetanus were also contributing co-infections during the plague. So let me go over symptoms and then what they did for people back in the day, what they tried to do to make them better. The symptoms are cough, coughing up blood, body aches, muscle aches, high fever, shivering, shaking, chills, violent shivering. Black lesions due to the bacteria collecting in areas and then opening up, turning gangrene in the hands, in the feet from the septic parts, and basic misery. It was just a miserable, horrible death for these people. Okay, you know those pictures of, they called him Dr. Death or Plague Doctor. They have those funny looking beak things. It's scary. So you're already scared enough. And then you have this plague doctor coming to visit you or coming to see your family or your community or your church area and trying to help you. And they come walking in the door looking like that. The treatment that they gave back then from these plague doctors was bloodletting. So we've all heard about bloodletting. And the point of that is to remove blood, yes, but also to reset the body. They also did cupping back then. And so they would heat up the glass cups real hot. They would place them over these enlarged lymph nodes. Think about that on your groin, on the lymph nodes there. And the reason that they wanted to put the cup over there with the heat and the steam is to burst open these swollen black lesions, because their thought was to get it out, to get that contamination, that infection out. They did a lot of praying. They used a lot of aromatherapy, a lot of herbs, a lot of spices. They also put frogs and leeches on the buboes. When those buboes are the bubonic plague, so this is what I'm talking about when I say the black swollen lymph nodes. They put leeches on them to hopefully break that open again and release the contents. So what do we do today? Is the bubonic plague still around today? Yes, it is. So around 1942, it was discovered that antibiotics would be the treatment of choice for the bubonic plague. It worked. So we finally, thankfully, have something that's going to treat people, because, again, like a lot of illnesses, you've got to treat people immediately. So within the first couple days, you want to start these antibiotics, start supportive care. Some people might need oxygen. Of course, they need pain management, IV therapy. They're going to get something for pain. They're going to feel better. They're going to be in the hospital and probably in the ICU most of the time. Some people, depending on how sick they are and if they become septic, they're going to have maybe some steroids and maybe even they need to be ventilated. The bubonic plague is still around today. And when I looked at where in the United States it mostly is, it's in the area where I live. So in the Pacific Northwest area. A gentleman recently from the Portland, Oregon area, the state of Oregon, came down with the plague and he nearly lost his life. He survived though. And thanks to sending out cultures and sending out labs and different information to the CDC, once they identified this bacteria, they all worked together to save this man's life. However, he did lose all of his fingers and all of his toes. How did this happen? So this gentleman states that his cat had caught a mouse and the mouse was in the cat's mouth and he said it was stuck in the palate. So he went to help his cat out and then he was bit himself. The cat died within 2 days. This gentleman came down with fever, body aches, chills, cough, thankfully, wherever he went in that Portland, Oregon area, they identified his illness immediately. They didn't send him away and say that he, is not that sick. They knew something was going on. So they found out, identified what the organism was, and then treated him appropriately with antibiotics. He was on a ventilator, and like I said, he did end up becoming septic, and he did lose fingers and toes. They turned black, and he had them amputated. But he does say he's grateful for his life and that he had no idea that the bubonic plague was still something that was around. A lot of people don't know that it's around. Other areas is the Los Angeles, California area and Colorado. One way that they tried to treat it back in the medieval time was as it spread, it really was, the area of Milan was hit hard. Italy was hit really hard. And what the leader of Milan used was something, what we call isolation today. He locked sick people in and got by with only a 15% mortality rate. He did not allow people to go out. He kept them in, he boarded things up, and he used a very strict isolation method, including having guards keep people where they're at. The Pope at that time was advised by doctors to sit in a ring of fire. And that was what they asked him to do to try to avoid the plague. It worked for him. He didn't get sick, but a lot of people around him got sick and died. And why? Well, there's a lot of theories to that, but one of them is not very many people are going to go through the ring of fire to get to the Pope. Was there something in that fire for the virus? It helped him. He lived. His staff and everybody else died around him, but he lived and he stayed in this ring of fire. Italian author named Giovanni Boccacino wrote that the doctors were unprepared for the plague. Does that kind of sound familiar? How can we be fully prepared? You don't know which organism is coming your way. But people were upset, saying you're not helping enough. You're inadvertently spreading it further. You're going from one person to the next. They didn't think about hand washing. They didn't think about coughing over here and coughing over there and touching all of this pus and other body fluids and then spreading it further as they came to visit their patients. That's where the weird long plague doctor overcoat came in, and that long, very thick leather beak. So it worked. But inside this beak were different types of herbs and spices to ward off the organism and to keep good smelling things in, because there's death and sickness everywhere that these doctors went. But it did work. That was their version of a mask back then. So today with COVID, we had our version of a mask, an overcoat sort of thing. And what helped us to try to get protected from other patients who are spreading viruses and not to spread viruses further. So in the hospital, before you go take care of this very sick patient who has something contagious or possibly something contagious, you're going to put all of this on and enter the room, take care of your patient, and then there's a special way of taking it off. Then you're going to clean, wash, sanitize before you go to the next room. That's how it is in a hospital or clinic. Anywhere today. Same thing, with babies. The midwives used to go from one to the other and spread everything. Now they are using gloves, of course, and we've got sanitation procedures in place, and people know to wash their hands. The other thing that this long leather beak thing did is it kept fleas out. It kept the coughing, respiratory illness from coming in, and if fleas got on them, they were unable to bite through this. So the doctors were doing better, they were surviving better, and they were not spreading it as much. They also had their own method of quarantine, and their quarantine measures were implemented to try to keep, this is all over. This isn't specifically like I talked about Italy at that time or Milan, but in other areas, they're thinking, how can we keep it from coming in? Because it comes in and wipes out cities, wipes out 50% of populations. What can we do? So they checked people out who wanted to enter the cities to see if they had a fever. They kept people out who were sick or feverish, even in the slightest. People who were sick couldn't come out. People who seemed ill couldn't come in. When it came to the ports, they also blocked off ports so that ships couldn't come in. They kept better and tighter controls of import-export. And they continued to use armed guards. They used force if they had to keep people quarantined. They forced people who were sick, they would to stay where they're at, and again, they would board things up. Venice implemented a 30-day quarantine and then a 40-day quarantine for those entering. So again, it was kind of the same idea. When we were at the height of the pandemic, if you wanted to go to Hawaii, you had to go quarantine for 14 days. If I remember the timeline right. I think it was 14 days in your hotel or wherever. They had people watching you. You cannot go leave and walk around. Restaurants were closed down. But back in the medieval days, you know, you did things like that where you were like, screw this, I'm not wearing it. No one's going to tell me. Well, you know that whole thing about how they like to do beheadings? Well, that's what they did back in the day. You don't obey those sorts of laws, and life was really, really bad for you. It was already bad for you. Why make it worse? Genetic immunity is also, it was, you know, considered back then as well. So as they are studying these bodies that they are digging up, what's the proper word for that? Excavated. Okay, so scientists are excavating humans. And there's a collection in various places. And what they're looking at, there's a lot of different things they're looking at. DNA, why did this population do better than that? Why probably did these people do better than those people? Why do some people survive and others die immediately with this illness? And it helps them learn today how we can best treat pandemics or different types of bacterial infections and understand why some people survive. What is it about them? Can they help others? What is it they're doing and how they're living to have them survive pandemics? Well, 50% of the population died. So these scientists dig up or excavate burial grounds, and they go to different areas to be examined. There are thousands of human remains. These people are called human osteology researchers. Have you ever heard of that? Not only osteo means bone, not only are they studying the bones, but they're studying the teeth, because the teeth is protected by dentin and enamel, and inside there they are able to extract contents, even if it's just a small amount, and get a lot of information from that. In the particular case of studying the plague, the teeth were sent to a lab in Canada. It took this researcher a full year to find that the DNA strand of the Y. pestis bacteria was there, and it showed proof. Here's proof that this lady, this female that we have been studying, did die from this. There's a team from the CDC who is in, I believe it's Colorado, where that is really the, I will double check that, but that is the place in the United States that is focused in studying on the bubonic plague. They're keeping a diligent eye out on this bacteria because the fleas, they're studying the fleas, and they're watching if these fleas are carrying this bacteria or not, because the bubonic plague is constantly mutating. So they're keeping an eye on the changes. Again, it's something that they don't want to become a pandemic again. There are approximately 2,000 cases of the plague worldwide every year. Like I mentioned, it's really critical to treat this within 2 days or 48 hours or immediately if you can. So the CDC has designed a rapid test, so kind of like a rapid pregnancy test, rapid strep throat test, so that people can get treated in a timely manner. During the plague, the 3 pandemics back in the medieval days, people died within 2 to 7 days. So that's the reason for the urgency. This is something that spreads quickly, kills people quickly, and you're miserable from the very start. So if we look at the biggest myth about the bubonic plague, it says that it wasn't transmitted just by rats, fleas, or other rodents or animals alone. And that is true. It's transmitted by the respiratory tract, by air, by coughing this out and breathing it in. And then the other myth they talk a lot about is that it does not affect poor people more. Now that's kind of confusing because the numbers do show that poor people in the poor, unhygienic areas died. More of those people died. I think the myth is that it only killed them, but it killed everybody everywhere. It didn't just kill the people that were poor, although a lot more of them died than the others. Remember not to handle rodents, carcasses. Don't try to fight with your cat over getting that mouse out or dealing with rats. Just call the professionals. It's not worth it, especially if you live in my area, Washington, Oregon, California, since that seems to be the area where the plague has been seen. Just like any virus or bacteria, the plague does mutate, and that's why it, is elusive and hard for the researchers to find out why it was so very virulent in certain populations in certain centuries. But it will continue to mutate, and that's why it's good that there are people that are keeping an eye on it like they are with other diseases and illnesses as well. What is claimed to be the reason that the plague got under control, and what is written about is quarantine. They didn't call it quarantine until later. They had a name for it. Surveillance, quarantine, strict isolation, those sorts of things made a huge, huge difference. And those are the methods that are still considered to be used today. It's used in hospitals. It's used in, if somebody has TB, they're not walking around if they have to be in the hospital. They are on proper medication. They are going to be quarantined or isolated properly for the period of time that is necessary. That goes for any other illness, bacteria, or virus that is highly contagious. I hope this was interesting. Oh, and if you want one of those plague doctor outfits, they sell them on Amazon and they sell them on Target.com. Okay, so you can get yours there. And one more thing, guys, remember, I have your back. I have your back. If you'd like this kind of content, if you are interested in medical things, history about medicine, myths about medicine, or mishaps, then consider subscribing.